So, welcome to Mums Get Fit Retreat, how to get your body back and feel sexy again after kids. This is the free online event specifically for the busy mum who wants to lose weight, tone up, and feel confident in herself and her body by eating better, working on her mindset, and working out. I'm your host, Jessica Marie. Today, I have a very special guest with you. Her name is Dr. Amie Horniman. Dr. Amie, aka the Thyroid Fixer, is a woman on a mission to optimize thyroid patients around the world and give them their lives back using her transformational program, the Complete Thyroid Mix method. Dr. Amie looks at each person as a unique individual and examines all the factors that tie into thyroid dysfunction, including their symptoms, and she treats her patients from top to bottom to help give them their lives back. Welcome, Amie.
Thank you so much. That was a beautiful introduction. Thank you, Jessica.
So today, Amie, tell me a bit about your journey, like where you started and why you do what you do.
Absolutely. So I think all of us in this space have that pain to purpose journey, right? Where we have gone through something that was really hard and then we learned from it and we can pass it on. So my journey started 20 some years ago, and I was doing fitness and figure competitions and fitness modeling. So as some of you may know, you have to diet down, you have to get really lean and fit, and the diet and exercise is really, really hard, and it's strict and it's focused. But I had done many competitions, many photo shoots, and I knew how it was supposed to go and how my body responded to each and every one. And there was one in particular where I was gaining weight instead of losing weight. But when the scale hit 20 pounds, I had stopped even stepping on it anymore. I couldn't take it anymore. I was tired. My hair was falling out. And I had went to doctors, just like most of us do, saying, listen, I know my body, something's not right. This shouldn't be happening. I know this shouldn't be happening. I know my body. And I kept hearing, you're normal, everything is fine. And back then I wasn't in the functional space, so I don't know what tests they were running. I'm going to assume not the proper testing. And they just kept telling me that I was normal. And then actually they told me to eat less and exercise more. Now I was already eating less and exercise sometimes 2 times at the gym every day.
Yeah.
And I just kept gaining weight and I kept getting misdiagnosed and told I was normal. Finally, after crying in my car and frustrations and just losing my mind, the 7th doctor diagnosed me, stuck me on the wrong medication. But, when you get the diagnosis, you're all excited, right? You're like, yes, I have an answer. There's going to be a pill to fix me. And that wasn't the case. There's so much more to that diagnosis of hypothyroidism than just a little T4 pill, than just Synthroid, than just Levo. So after 5 months of no change, I finally sought out functional medicine. And I went to my current doctor and I said, hey, I've been doing some research just like we all do. And I found this thing called T3. And it turns out this really looks like it's promising and that it works really well with this medication over here that you gave me, T4. Can we try it? And she goes, no, I don't do that. I said, I'm going to find somebody who does. Found the functional medicine practitioner who then became my mentor. He gave me my life back. So that's what I do now with my patients. Tested me thoroughly, treated me properly, looked at the underlying causes, looked at everything else that ties into health and the thyroid and nutrition, the whole deal, top to bottom. And after going through that with him and learning and getting my life back, I said, that's it. This is my career. So I changed trajectory, and now my career is functional medicine and treating thyroid patients and literally giving people their lives back.
Wow, Amie, it sounds like a pretty incredible journey. So why would you say that thyroid, like having a thyroid that is optimal, why is this so important to a busy person, somebody like a busy mum? Why is it really so important?
So we have to remember that the thyroid gland is the master gland. It runs the show. It runs your entire body. Every single cell in your body has a receptor site on it for thyroid hormone. And we can get into the specific thyroid hormone in a minute. But every cell in your body, so you have to think your energy to just get through the day, your brain to function and focus and think clearly and complete a sentence, the ability for your body to utilize the food you're giving it and turn it into energy and to burn fat, just to run your heart, takes thyroid hormone. So your thyroid is the master gland. If it is off, it will cascade down and throw off multiple systems of your body. So that's where we see various symptoms and some really, like, I don't want to call them wacky symptoms, but things that you wouldn't think would be. We think of thyroid, we think of weight, we think of energy, we think of hair, we think of brain fog, we think of constipation, frozen shoulder, allergies. So these are things that people are like, what's going on with me? What's going on? And it all comes back to that master gland of the thyroid. That's why it's so important for a busy mom to get through her day, whether it's 1 kid or 5 kids. You need that energy. You need your body functioning at an optimal level. You need all systems a go and working properly and working in sync with each other. And if the thyroid is off, you're not going to feel like yourself. You're not going to make it through the day. You're not going to feel like a good mom because you're going to feel like, I'm not doing enough, but I don't have the energy. I can't take care of the kids. I can't cook dinner. I can't clean the house. I can't fold the clothes. I just can't. And then it just cascades into just frustration and depression.
That's incredibly insightful, Amie. So what would be the main factors that you would say influence a sluggish thyroid? Lifestyle factors we're talking about.
Lifestyle, yeah. So we have to start with, I'm going to start with that a sluggish thyroid, hypothyroidism. 95% of that is actually, it's Hashimoto's. So hypothyroidism and Hashimoto's are kind of interchangeable terms. So when I say Hashimoto's, I'm talking about an autoimmune condition. So we know that when someone is diagnosed with hypothyroidism, most of the time it is their immune system attacking their thyroid gland. So it's an autoimmune condition. Incredibly common after pregnancy and after any kind of stress. So what we see with Hashimoto's, hypothyroidism, is lifestyle factors such as not getting enough sleep after you have your baby and you're getting 3-4 hours of sleep. That alone can flare up an autoimmune condition. It can turn on an autoimmune condition. Things like eating poorly, when you're exhausted, you're just grabbing whatever, you're grabbing the burger, you're grabbing the snacks, you're eating your food, the nuggets off of your kid's plate because they didn't finish them. And all of that processed food, the carbs, the gluten, that will flare an autoimmune condition. Stress, just the stress of being pregnant. So listen, we're women. It's a natural thing to do. You have babies, right? We kind of brush it off as that's what women do. It's a stressor on the body. Your body is carrying anywhere between 15 and 60 extra pounds, depending on how much weight you gain, and your hormones are going all over the place. That is a true stressor on the body that can easily inflame the thyroid, make it be more sluggish, turn on that autoimmune switch for Hashimoto's. And then when everything combines, if you're sitting there saying, well, that's me, and that's me, and that's me, I have no sleep, I eat poorly, I eat the food off my kid's plate, and I gained 50 pounds with my last pregnancy, boom, all of those things work together to just deplete the thyroid. Everything just goes low, it goes slow, it just craps out, and that's it.
So when you discover that there perhaps is something going on with your thyroid, how long typically would it take to make improvements with it?
So when I work with patients and I address it from a natural standpoint, so we're starting to do those lifestyle changes in the very beginning. So we are changing the diet. We're looking at underlying factors like, are you insulin resistant? How are your hormones? Are you estrogen dominant? Are you walking around with type 2 diabetes? Are you walking around with an underlying condition like Epstein-Barr virus or Lyme, anything that's going to inflame you? When we're looking at your gut, when we start treating all of those things that sometimes we even take for granted, like sleep or like just don't eat the bread, just those little things. Go for a walk, take a deep breath. Yep. All those little tiny behavioral changes they just start to make the body shift. Now, there are some times where we have to supplement, especially nutrient deficiencies like zinc, iodine, magnesium, selenium, vitamin D, that are vital to the thyroid gland and to hormone production. Sometimes we have to supplement. Sometimes we do have to use thyroid hormone replacement therapy in those cases where the thyroid gland is no longer producing the correct amounts of thyroid hormone. And maybe you are in the later stages of Hashimoto's where the thyroid is so depleted and so broken down and so beat up that we do have to give you a little bit of thyroid hormone in order to supplement what's no longer there. Sometimes those are the cases, but really, I mean, it could be anywhere from the first few weeks of change into like 6 months down the road where we see that big transformation occur, where someone goes from just broken down and tired and frustrated and depressed to literally who they once were and getting themselves back. And you see that light and that glow in their face because they have everything back. They are who they once were.
So it really is a journey, and there isn't a quick fix to it. You just have to, I guess, take the time to let the healing take place, and that takes time.
It does.
So how does this all tie into weight loss? Specifically?
So definitely with weight. So that's probably weight and fatigue are the top two symptoms that we see when someone is suffering with a sluggish thyroid, hypothyroidism, Hashimoto's. And when we think of, so that was the big thing that hit me. It was that weight that was coming on and coming on and coming on. And no matter what I did, no matter how perfect my diet was, no matter how much I exercised, the weight would not come off. And in fact, it kept coming on. So that really shows us that the thyroid gland, being the master of our metabolism, it dictates whether or not your cells are going to use energy for fuel. It dictates your basal metabolic rate, how much you are burning, how much energy and fat on your body that you are burning at rest, and how you can utilize the food that you're taking in. So when the thyroid is slow, it's it doesn't matter what you do. I have so many, especially women, come to me and they've done everything. They've done every diet, every supplement, everything that they see on TV and read on Dr. Google and see in Facebook groups. They've done it all. And they're like, it's not working. No matter what I do, it's not working. That's because your thyroid is broken. And until we fix that, you could be the most perfect human being in a bubble and you're still not going to lose weight because your thyroid is off, and that's the master gland.
So basically, if a woman like yourself is doing everything she can to lose weight and it just isn't working, what should she ask her doctor to test for?
Right. So you can't go in and ask your doctor to say, hey, doc, can you test my thyroid? Because here's what's going to happen. You're going to get a test called TSH, and that is thyroid stimulating hormone. Now, that is not a thyroid hormone. That's actually a pituitary hormone. So our pituitary is a gland located in our brain, and that sends a signal. So P, pituitary, talks to T. It talks to our thyroid. So there's the hypothalamus pituitary thyroid axis. So P talks to T, and pituitary says to thyroid, hey, thyroid, you're not making enough thyroid hormone here. T4 and T3 are the two thyroid hormones. We'll get to those because those are important to be tested as well. You're not making enough thyroid hormone. So you need to wake up. You need to do your job. We need you to produce more here. So when TSH, thyroid stimulating hormone, released from the pituitary gland goes up, That's one of those tests where high means low. So the higher that number goes, the lower your thyroid is working, the more sluggish, the more hypo low you are. And that's where everything slows down. Now, if TSH is off the charts and you have a little H next to it and it's flagged red on your labs, your doctor will stop and maybe take a look at it and go, hey, you know, Susie, it looks like you have a thyroid problem. But what if TSH is normal? What if it's in those within normal limits, those huge standard lab value ranges where you fall right in the middle and you don't get a little H next to it and it's not bolded out red where anybody's going to look at it? Guess what? You can still be hypothyroid because TSH is a pituitary hormone. It's not a thyroid hormone. So now we have to go down and look at free T4 and free T3. So T4 and T3 are the two thyroid hormones. T4 is inactive. It's your storage. It's the gas that's in the tank, but the car is not on.
Yeah.
T3 is the gas and it's the go and it's the engine and it's the rev. That's what gives you life. And every cell in your body, how we talked about earlier, has a receptor site on it for thyroid hormone. It has a receptor site on it for T3 only, not T4. We still want to test though. We want to see what's in your storage and what is active, what is ready to be taken up by the cell. Free T4, free T3. Now, if T3 is the gas, we have to test your brakes. So we have to test reverse T3. Those are your brakes. If that goes up, reverse T3 is a survival mechanism of the body because when you're in the ER or you're in the ICU or you're injured or you're in trauma, the last thing your body thinks of is losing weight, growing your hair. It doesn't care. Reverse T3 is going to go up to say, hey, we need to slow down this person's metabolism so they can survive this trauma. When reverse T3 is high and you're walking around trying to be a mom and a woman, that's not good. Those are your brakes. That's telling us that your brakes are on and your gas isn't working. So we have TSH, free T4, free T3, reverse T3, and then we have two thyroid antibodies that tell us whether or not your hypothyroidism is truly Hashimoto's, is an autoimmune condition. Those are TPO, thyroid peroxidase, and TG, thyroglobulin antibody. You want to ask for all of those. If you don't have every single one of those tests, we cannot get a full picture of what your thyroid is doing. Because I have seen beautiful, even functional medicine, optimal TSH values. And then I look at the free T3, the gas, and it is in the basement. And that person is suffering. So we have to look at all of the tests to get that full picture.
It's very interesting that you could be potentially classified in the normal range and things might not be quite right. So for somebody who really has like not the background that you have with this, like what is the specific sort of things that you would ask them, they would ask a doctor to measure?
So you want to get all of those thyroid tests and you want to write it out. You want to write those tests out and specifically ask your doctor to please test these. And my rule of thumb is if your doctor says no to testing, it's time to get a new doc. Because it's no money out of their pocket and they should want to know what's going on with you. They should want to know that full picture of your health. And if they don't want to know, then you want to find somebody who does want to know because the person that does want to know actually wants to help you and see you get better. So we want to get that full thyroid panel, that all of those tests. And then contributing to the thyroid, if I have my wish list to see on a patient, I'm going to look at their sex hormones like estrogen, progesterone, testosterone. I'm going to look at their adrenal glands like DHEA and cortisol. I'm going to look at their insulin and their A1C, and I'm going to test for Epstein-Barr virus. I'm going to test for Lyme disease. I'm going to look at an iron panel. I'm going to look at their vitamin D and iodine and magnesium and selenium. Somebody might have to replay this in order to write all those down, but you want
it's comprehensive.
Yeah, it's just that comprehensive full look. So I'm not saying that you're going to get every single one of those tested by your doctor. Many, many times my patients will hear, well, insurance won't cover that, or I don't test that. Listen, if you can just start with the basic thyroid panel, if you can start with what we went over, the TSH, free T3, free T4, reverse T3, TPO, TG antibodies, boom, there is your thyroid picture. We can get enough information from that to know what's going on. And then even after we get that picture, then we can say, okay, your thyroid's off. Let's look at what it's affecting. Oh, look, you have skipped periods. You have no libido. You have facial hair. Your testosterone might be high. It might be low. Let's test your sex hormones. Okay, we're fixing your thyroid and you still can't lose weight. Let's look at your insulin, because if you're insulin resistant, that can affect weight as well. So there's a variety of downstream factors that we can look at after we get that full picture of what your thyroid's doing.
So what might be the different symptoms with thyroid issues versus insulin resistance if somebody was trying to decide what possibly it could be for them?
They mimic each other. They mimic. So that's where it's test, don't guess. So it's so interesting. We can take hypothyroidism, we could take insulin resistance, and we could take something like PCOS, polycystic ovarian syndrome, which is classically low progesterone and higher testosterone, with missed periods, sometimes acne, usually weight gain, and usually that is tied to insulin resistance as well. We can take all of those and they mimic each other. Unless you test, you really don't know. Now, the classic, really with hypo, that's when I'm looking at a patient's intake form and it's just classic. It is weight gain, inability to lose weight, brain fog, constipation, hair loss, extreme fatigue. And when you see all of those, especially with the hair loss, you go, well, we have to check your thyroid, because even if insulin's off and even if you have PCOS, 9 times out of 10, your thyroid's going to be off too. So we're going to check that.
Yeah, that's amazingly insightful as well. So for somebody who is trying to lose weight, but they may not be focusing on these things, like they may not have thyroid on their radar, is there any like exercise that could be harmful to them? Like, is the intensity of the exercise bad for the thyroid, or what would be your recommendations there?
Oh, that's a great question. So yes. So I always say, first of all, running is just silly. You don't want to just run and be a cardio queen. Cardio will work against you. Now, this could span beyond thyroid conditions as well. But when you are dealing with, let's say you have subclinical hypothyroidism, or you have a thyroid condition that is not diagnosed yet, or you are diagnosed, but you're put on a medication like I was that's not working, and you try to work it off. You try to crush yourself at the gym. You're going twice a day. You're doing 45 minutes of cardio. You decide to take up CrossFit 6 days a week. That is going to put a stress on your body that you are not capable of handling at that moment. I'm not saying that high intensity interval training is bad. I'm not saying CrossFit is bad. I don't like running at all. I think it is bad. But it's not that it's a bad thing to do. It's how is it going to affect you in your current situation? So if you have hypothyroidism, we always have to look at the adrenals and cortisol. The last thing you want is high cortisol levels. If you pound your body in an effort thinking that more is better and more is going to work, and maybe if I kill myself a little bit more, I'll lose this weight, it can absolutely work against you. So I want to find balance with my patients. Even once we get them optimized, I tell them, listen, because you're optimized, it doesn't mean to go out and kill yourself now. You need to find that balance of weight training, throwing in a high intensity interval training day. Go ahead and do CrossFit 1-2 days a week if you love that. Olympic weightlifting is great. I love powerlifting. I came from a powerlifting background as well. And then throw in some hot yoga. And then don't forget to breathe. Take a walk with your dog and get off the phone. Those, get that perfect balance, or find some semblance of balance if you can. You don't want to be all or nothing. You don't want to kill yourself or say, I'm not going to do anything now. You have to find that balance.
Yeah, absolutely. I couldn't agree more with all of that. So also going back to the weight loss scenario, because most people tend to think eat less, train more, like that's the typical recommendation. Obviously, we know that's not the best advice, but What would you say about eating less and like restrictive dieting and low calorie diets? And if you were to do like that, it's the exercise, the intense exercise, as well as the low calorie dieting. What does
Right.
then that put you into?
Right. Excellent question again. So if we go back to my story, and I can't go back in time and see it clearly. I can only guess, right? So this is way before I got into the functional medicine space. Let's face it, by doing fitness and figure competitions and fitness modeling, and I did not come from a skinny lineage. I have obesity and diabetes in my family. So I always had to work my butt off to get down to where I was ready to step on stage or step in front of the camera. That extreme dieting, that restrictive dieting, that killing myself at the gym twice a day, hindsight, not a good idea for my body. So it's entirely possible that that behavior is what flipped that autoimmune switch, is what turned on my Hashimoto's, because we know any kind of stressor can. So puberty, perimenopause, pregnancy, any kind of heavy stress. And we know from studies that caloric restriction over time, which I certainly did it over time, will drop the free T3 level. Now, we said T3 is the active thyroid hormone. That's what gets into the cell. Your receptor site or your cell has a receptor site on it for T3. If you drop your T3 through excessive dieting, you're not going to have enough to get into the cell to run your body. So that behavior alone can drop your thyroid into a hypo state or turn on Hashimoto's, because it is seen as a stressor. Excessive exercise, caloric restriction, malnutrition, restrictive diets, all a stressor on the body.
Very interesting. I've got one final question for you in regards to all of this. So if you were somebody who does have stress in their life that may not be something that they control, like with mothers who are sleep deprived, massive stress on the body, what would be your advice to people who, like, to some degree they can't control it, but what would be your advice there? What path would you recommend them to?
Right. So it's kind of it's a balance of a little bit of self-acceptance and self-forgiveness, right? On the one hand, we all have stressors that we're dealing with. You, me, neighbors, the person down the street, the woman listening to it, everybody has stressors that you cannot get rid of and you can't change. So it would be cliche for me to say, de-stress and declutter your life like you read on the internet, right? It's just, I mean, listen, it's not a reality for most of us. We're all going to have it. So it's how we deal with it and how we perceive it.
Yeah.
It's shifting that mindset. And this is part of, I actually make it part of my, my packages, my services with my patients, because I found that mindset, that subconscious belief system, those negative mindsets are more stressful on your body than lack of sleep. So it's one thing if you're a new mom and you're not getting enough sleep. Listen, we get it. You take naps where you can. You take the 5-minute snooze where you can. It's not going to last forever. You're going to be okay. So what can you do to support your body and not allow yourself to fall into that negative mindset, that negative pattern of thinking, where then you get even lower? Then you go, you start getting into self-pity, and you start getting into worry, and you start to worry about your body and worry about your health. Oh my gosh, I'm not getting enough sleep. I heard on Oprah that I'm going to gain weight if I don't get enough sleep. Now it's this vicious cycle where your mind is spinning. You need to stop. You need to accept and accept that you yourself, and have some self-forgiveness. You're going to get through it. Everybody does. And everybody has a stressor. What can you do to shift your belief system? What can you do to take care of yourself? Can you write a letter to your doctor or call your doctor's office and get a few tests done? Can you take a 5-minute nap? Can you at least nourish your body with good foods? Because, just getting out of the processed foods and nourishing your body with good quality, real food that doesn't come in a box will help you through those sleep deprived states, will help you through the crying, will help you through whatever stressor, taking care of a parent while you're taking care of your child. All of those stressors that we all deal with, doing those little things for yourself will carry your body through. It really will.
I love that. Just such great advice. So many amazing pearls of wisdom there. Thank you, Amie. Thank you so much for your time today.
My pleasure. Thank you for having me on.
No worries. I really wanted you to just share a little bit about your free gift that you have for everyone watching.
Absolutely. So it's a free ebook. It's 12 weeks to weight loss with tough love and brutal honesty. So if you haven't picked up, I tell people what they need to hear, not necessarily what they want to hear. So if you are eating a bunch of processed foods, I'm not going to say it's okay to do that, right? So there are, in this free book, there are many. I have all of the thyroid labs that you need to request. And we have all the other factors in there to look at, such as insulin resistance and hormones and gluten and sleep and stress. So they're giving you all those little pieces, allowing you to kind of work through it and think through each piece in a separate week. And we're just real with it. You know, we're just real and honest, and listen, let's get honest with each other and put it on paper. What are you putting in your mouth? And it really makes you think. So that is my gift to all of your listeners.
And it's an ebook?
Yes. Downloadable ebook.
Great. So guys, you can pick that up at the link below this video. And I think it'll be extremely awesome to do so, because there's stuff we haven't covered today, gluten stuff. So very important to have an understanding of all of that. So thank you guys so much for watching today. Be sure to stay tuned for tomorrow's upcoming interview, and I'll see you there.